So I'm going to shift us a smidge again, as Chelsea said, and talk about the next domain that we support with in pediatric palliative care. And that is providing anticipatory guidance and engaging in advanced care planning. Now, providing anticipatory guidance means helping patients and families prepare for what might lie ahead, medically, emotionally, practically, right? Thinking about just logistics, right, of seeking care at an institution or closer to home. It involves proactively sharing information about expected changes, possible decisions, and how care might need to be adapted. The goal isn't to predict the future with certainty, right? As we heard both Suni and Chelsea share, right? There's always going to be uncertainty in what's ahead. Although I think we all wish we had a crystal ball sometimes, right? And could predict that future. But to the best of our ability and knowledge, partner with the medical teams to offer a roadmap. And that includes discussions around treatment options, symptom management, supports, care location, preferences, and when appropriate, end-of-life planning. Now, advanced care planning is a natural extension of this process. It's a collaborative, ongoing conversation between the patient, family, and medical team that aligns future care with the patient and family values and goals, right? Like we've talking about, throughout this presentation today. And advanced care planning may include preferences around resuscitation status, treatment limitations, again, locations of care, also legacy building, how a patient might want to be remembered, and care after the end of life. Advanced care planning evolves over time, often prompted by changes in condition or goals, right? Reviewing these time points and with iterative conversations. So our role is to recognize these moments, create space for discussions, and use the available resources and communication tools to support patients and families in planning ahead. So I thought we would talk more about what some of these tools might look like, right? Kind of behind the curtain. And one tool we use to engage families is simple and powerful. And that is these what-if conversations. Now, these are gentle, open-ended questions that invite parents or caregivers to explore hopes, fears, the possibilities ahead. So you might hear us asking, I find that many families wonder, what if things don't go as we hope? Is that something you would want to talk more about today? Or when you wonder, what if things don't go as we hope? What comes to mind? And these conversations, again, are not about making any decisions right away, but really about helping families and caregivers think ahead so we can keep the care aligned with what matters most. And alongside these what-if conversations, we also use concrete tools like my wishes and voicing my choices to support advanced care planning with children's, teens, young adults, and their families. These are actually booklets, right? So you could actually work with your care teams if it makes sense to kind of work through some of these. And they offer a structured way for patients, if they're able to engage in this process, or their families, loved ones caring for them, to express what matters most, how they might want to be cared for, what brings them comfort, and how they'd like to be remembered. It can include anything from medical preferences to personal messages, spiritual beliefs, or simple wishes like what a child's favorite song is, or who they want nearby them if things are changing fast. And my wishes here is designed for younger children, while voicing my choices is really tailored for adolescents, young adults. And for grown-ups, for adults, there's also a 5 wishes advanced care planning tool document that I encourage all of you to check out for yourselves. But using these tools really helps ensure that the voice of the child, teen, young adult is heard and honored and a part of the care that we are planning. Moving forward to the next domain, we in pediatric palliative care help a lot with communication coordination. So that means our job is to ensure consistent communication around prognosis, illness trajectory, goals of care, and care pathways, right? What we learned a lot from Suni from earlier today. We also help to facilitate collaboration across care locations, medical specialties, and time. And here at Boston Children's with the team that we work with, we have the privilege of sometimes supporting patients and families for days to weeks to months to years, and sometimes even decades. There are patients on our team we followed for decades, which is amazing to see the child and family grow with time. And lastly, we serve as a bridge, right? And that is for patient and family goals with multidisciplinary team assessment. We work as a subspecialty pediatric palliative care team, right? And often guide the primary teams caring for you or your child and making sure the care is most aligned with what's most important. All right, we're going to keep shifting along in the domains here. We're aware of the time. We also help with education and team support. And just to name out loud to all of you in the room, we are so grateful to be invited to the conference today and to speak to you all about how pediatric palliative care can be helpful in heterotaxy. So this is actually one of our very important goals. So thank you for having us. We love to provide evidence-based education so you all can learn more about what we do because there's a lot of misconceptions out there. We also encourage concepts and the practice of resilience to support professional engagement, meaning-making, and purpose. And one of our division chief, Dr. Abby Rosenberg, is actually one of the leading experts in resilience research. So we're incorporating her teachings, lessons learned into our clinical practice to continue supporting patients and their families. And lastly, we also, like to provide a lot of support to teams, right? The work that we do is often difficult. So being there to understand and listen to teams' concerns, offer that supportive listening, and really using what we know and what we can explore with patients and families about goals and priorities, right? Again, to really partner together to provide everyone the best care possible. And one of the most difficult parts of our work and difficult things to talk about, right, is bereavement support. Sometimes despite all interventions, everyone doing all of the things we can, sometimes children may die secondary to their medical condition, so a bereavement support is a part of our job. And through that, we provide anticipatory guidance about what to expect at end of life and immediately after, including symptoms, logistics. We ensure opportunities for legacy and meaning-making activities, exploring and enabling end-of-life rituals, what is most important to each and every family, and all of that is unique. And lastly, we provide support in the years to follow after the death of any child that our team follows. We have a program that extends at least 2 years, if not more, that we stay connected with families. And I just wanted to take us back to the community-based pediatric palliative care resources that Suni spoke a little bit about earlier. So here in Massachusetts, we've got a couple that are easy to access. The first is the Pediatric Palliative Care Network, and that serves children with life-limiting illnesses and their families. There is no cost for these services for a child aged 22 and under. And they provide home-based services such as a visiting nurse, social worker, and other therapies like music, art, child life, chaplaincy also comes by. And Courageous Parents Network is also an incredible online resource. Has anybody heard of it in the room? Oh, we got one down the aisle. Oh, amazing, thank you. You're getting a brochure now. But Courageous Parents Network is a nonprofit organization that provides educational resources, community and support for families and others caring for a child with serious medical condition. It was founded back in 2014 and uses both family and clinician-facing resources such as videos and audio stories, guides and blogs, even events and webinars, all designed to help navigate the challenges of a child living with serious illness. So we'd encourage you to check it out. So we hope you learned a lot from our presentation today, and just to kind of bring us back to when should you consider palliative care involvement, right? If there's complex care across any of the domains we talked about today, if communication challenges are coming up, if there are refractory symptoms that we might be able to help think about and potentially treat, if there are upcoming decision points, And really, anytime it crosses your mind, we are here to be helpful. We are here to be helpful. So without further ado, thank you all again so much, and we'll have time for questions. And if you could all take a moment and scan this QR code for us, we love to get feedback on our presentations and bring this back to our teams about the impact of our teaching, and sharing how palliative care can be helpful to folks like you. So thank you for completing that for us. Thank you.